Welcome to Voices in Value-Based Care. I'm Beth Houck. Thanks for tuning in. The movement to value-based care is revolutionizing how healthcare providers get reimbursed for delivery of care. In this program, we're going to explore stories from the field about how real organizations are dealing with this change. You can follow the show on Twitter at #VoicesInVBC and follow me on Twitter at Beth Houck. On the program today, I talked to Deanna Parker, a nurse by background and Vice President of Emergency Services at Hardin Memorial Hospital. Deanna, welcome to the show.
Thank you so much for having me.
Well, I'm very excited to talk to you today because we are kind of hitting things from a different angle. So a lot of times in value-based care, we talk a lot about data and population management and things that drive value-based care from more of an analytics standpoint. But today, we're going to talk about good old-fashioned communication and how at your organization that really changed how you guys did business and ultimately had the impact on value-based care, or I should say, had the impact on patients that ultimately supports value-based care in the way that you want it. So I'm really excited to take it from this angle. So if you don't mind, just to get started, maybe tell the audience a little bit about your role in your organization so that we know a little bit about Hardin before we talk about what you guys implemented.
Absolutely. Thank you again for having me. I am a nurse by background, spent most of my time in critical care nursing, and then ended up going into nursing leadership, and mainly in that area, also overseeing critical care and med-surg nursing. And then I've made my way to the emergency department, which is a whole other world all in itself, and I've learned that. Hardin is, you could look at Hardin as a regional medical center. We are kind of smack dab in the middle of 10 surrounding counties, so it's a ever-growing organization. The emergency department has had about 36% growth in the last 6 years. We are the second busiest ED in the state and likely to bump our way into the first. So it's very busy. It might have a little bit more of that community feel when it comes to the rest of the organization, but our emergency department has the challenges of an urban emergency department, especially with the amount of volume that we have. So hopefully that helps give you a little bit of an understanding about the hospital.
Sure does. And if the audience can't tell from Deanna's slight little accent, Hardin is in Kentucky, correct?
Oh, yes. Thank you so much. Yes, we are in Elizabethtown, Kentucky. So,
which partially makes your geography interesting and partially refers to your point about being smack dab in the middle of all these counties and kind of drawing from a pretty big geography. That's important. So when we started having the conversation about this technology that you implemented to help support communication, it really started about solving a problem. You know, you guys recognized that there was a gap. Can you talk a little bit about what inspired or instigated the search for a better solution?
Absolutely. So my role was new in the organization. They had the senior leadership team prior to my arrival felt that with the amount of growth that they were seeing in the emergency department, they needed to have an executive leader oversee that. There was also, because they were moving from about a 16,000 square foot floor plan to over 32,000 square feet. They were seeing already over 70,000 patients in a space that was only built for 40,000. So a lot of challenges when I came in. It was a multiple year, multiple phased construction plan. So they were really looking for somebody to come in and really help kind of guide through that and start heading things in a different direction. When I came here, I feel like I got a lot of this will fit right perfectly with Kentucky, but a lot of bless your heart because people were like, the ED was the talk of the county and not necessarily in a positive way. A lot of delays, a lot of unsatisfied patients. And so when I happened to take my first day in, I just decided to shadow and got in there with the nurses, and it was immediate that they really could not communicate with one another. And so I watched, and their processes were not streamlined, and their idea of communication was, as we were kind of split up in between a phase of where we were in a newly constructed space and then a previously existing space where they could usually just kind of look over and say, "Hey, Sally, can you help me with this?" Well, the new space was fantastic and beautiful, but you couldn't find anyone, and you certainly couldn't hear anything. From a safety perspective, we had put up a lot of glass so we could visually see our patients, but that glass is pretty fantastic, and you cannot hear through it. And so everything just seemed to be just disjointed. And so the staff were also, on top of the patients not being very pleased, the staff weren't very pleased, which those things go hand in hand. So my ultimate goal after a couple of days of shadowing was I need to find some way to connect everybody. And they need to be able to talk to one another, and preferably in real time, because that was adding to the issues that we were having. When patients come to an emergency department, something that is really looked at from a quality perspective is efficient. People want to be able to be in and be out and get the treatment that they need. It's a very different culture than if you're an actual inpatient in a hospital. And so we had a ton of work to do. So my ultimate problem to solve was the complete lack of communication.
I find so interesting that it's this beautiful new space, probably solving all kinds of other problems by being in this new space, the visual, like you said, with the glass, and prettier and nicer and more spacious, especially to attract, or not to attract, but to necessarily like kind of just serve a growing volume that you had. But I think it's always interesting when fixing one problem creates another, a sort of a whack-a-mole situation.
Oh my gosh, yes. And it was interesting when I had to go back and tell our CEO, I'm really glad that you all decided to renovate and do all of this. I'm really happy to be here, and I think you probably will think it's going to be better, but it's going to get worse because now I've realized that no one can talk to each other. And
Right.
Everyone's looking at me like, oh, what do you mean you have this gorgeous space and now you can treat all of the people? I'm like, we can't talk to one another.
Well, let's talk about what you then ultimately adopted. And obviously we know the why, but what did you ultimately adopt to try to solve this communication problem?
Absolutely. When I got there, the team was using, or they had the ability to use, I won't say they were using because they weren't using it because it wasn't working, but they had a smartphone with an app on it they could use to communicate. Problem is, when you double the size of the space and you can't hear things, it was dependent upon a nurse hopefully hearing a text message ding. And then the problem with that is, in a busy emergency department, they're in the midst of patient care and that sort of thing. So having to stop, take gloves off, if they happen to be starting an IV or that sort of a thing, to then text back, it just wasn't happening. And so needed to find some way for them to have that real-time communication without the hassle of I've got to be able to find my phone out of my pocket and I've got to hear it. So what we ended up adopting was the Vocera communication platform. It's hands-free. We looked at a lot of other products. We did some site visits so people could get a real understanding, but at the end, and the staff was 100% involved in this, because the reality is, with the amount of volume that's growing year over year, these challenges are going to keep coming. I knew that they would have to be able to have their voice or it wasn't going to work. So they ended up selecting the Vocera platform so they could literally have the ability to have that communication hands-free. So they wear a little device on their lapel, and they're able to just answer by their voice and communicate, whether that be with a provider or another nurse. So that was what we ended up adopting.
So I think you obviously did something really smart, which is you involved them in the decision, which ultimately leads to a smoother implementation because you don't have to spend as much time, right, getting people to adopt it and convince them to use it and things like that. When you very first started implementing, what surprised you the most? Like you kind of have an expectation for how it's going to roll out. What went better or worse than what you expected?
Well, I think what went better than I expected is I have used Vocera in a previous organization on the inpatient side, which is not as dependent on their ancillary support departments. It was a game changer for us because I did not realize that once Vocera came on site and we had the ability to talk with them about creating our workflows, it was like light bulbs went off. And so we were able to actually design the workflow the way it would work best. So steps, processes that took about 7 steps, we were able to get down to 3. But we were able to do that we didn't initially have this in the plan either, but connecting all of our support departments. So our radiology group, that's anybody actually functioning in our emergency department, providing care to these patients, we ask that they now wear a Vocera device. So security wears it, phlebotomists wear it, the registrars wear it, the imaging folks for X-ray and CT wear it, all of the providers and nurses. And we didn't necessarily see it playing out in that perspective. It was more initially about getting the nurses and the doctors to be able to communicate. So positively surprised by the fact that once we kind of sat down in those workflows and realized how much of an impact it had to connect all of us. And it exceeded my expectations from that perspective, because in the emergency department, you are so dependent on, a provider cannot make a treatment plan until we have lab results back. And, if there's a delay on the lab or they have to do a recollect, we've got the ability now to immediately have the lab, utilize the Vocera communication, contact the phlebotomist that's designated to the emergency department, and let them know we get a recollect. So all of the processes have become much more efficient. So it was such a wonderful surprise how that played out and how connected we all are now.
So I love the idea that, you guys went beyond your kind of 4 walls, your department, to connect, all of these other ancillary departments that help support you guys doing what you do. It also sounds like probably adoption, kind of changing habits was easy in the ER. Was it harder to get some of these other departments to change their habit of, sending a message through the EMR or using the text system or doing something else? Was it harder to get them to adopt it, or was the benefit so great that it was, kind of easy?
It really ended up, I feel like the benefit was so great for those that were stationed down in the department. They could see it happening, and so they wanted that ability to have, that real time. It's like that instant gratification that we all want. They wanted that.
Yep. Mm-hmm. It's like the little chat bubble, right? When you're on a website, you just want to get questions answered, right?
Absolutely. Now, I will say, though, the ability for those that are up in the lab, so they're not actually down in the department and don't see it, we had to work a little bit to break habits on them just calling the unit secretary, because they can actually pick up a phone and dial into Vocera and actually speak to the exact person they need to. So, but they couldn't visualize what we were seeing happening down there. So some of those areas that didn't actually have to wear the lapel and weren't in the department to see that instant gratification that we were all seeing, it took a little bit of time to break their habit of calling a unit secretary, in which is more and more phone calls, and then there were delays for our secretary to then transfer them to the right person. We've moved past that now, but initially that was where I had the biggest challenge. I would also say that I had some of the providers that were a little bit hesitant, but it was really important. Along with that staff, I had a physician champion who really helped me, because they were almost kind of waiting to see if it was really going to work, and they were kind of sit on the sidelines. But the only way for it to work initially was that they had to use it. So those were probably my 2 biggest challenges at the beginning.
I bet patients love this, because, and without realizing that they're loving a communication tool, they're just loving that things are happening faster. Tell me some stories about how that improved communication really helps support these patients.
Absolutely. The interesting thing, too, is they accept this in such a different way. When a nurse would have to pull out their phone and utilize the app on their phone to text, it was perceived by our patients that they were just on their cell phone, their personal phone, which made the patients obviously not feel like they were the priority. I would get feedback in our surveys about staff being on their phone. This is perceived so differently. We communicate with them that this is the device we use to ensure that we're getting them the care they need when they need it. It raised the level. They can actually see us in the process as well. I think the thing that they love the most from this is that they are updated much more constantly. So because we've connected everyone, if there were a delay in the CT scan, that's being communicated to us real time, in which the nurse can then let them know, you're next to go. It's going to be about 15 minutes, as opposed to them just kind of sitting there wondering aimlessly for 15 to 20 minutes. It's that lack of someone telling you what's happening. So I think the thing that is the most appreciated by our patients is the ability to know what's happening throughout the whole time they're here getting their care.
It makes sense. And I hadn't thought about the kind of downside of using a cell phone app, but that does make sense to me. I could see how that perception would be that the nurse was doing something else. So, okay, so even though I started at the beginning that we got to not talk about numbers or metrics or make this a very analytical conversation, I'm betting you have numbers that support your success. Tell me what numbers you think really illustrate the impact the most.
Absolutely. So you probably can sense my passion, because I feel like this whole experience at Hardin and this implementation is like the first time I've ever been able to really, you have a professional dream and I've watched it come true, because it's like you want to be able to see graphs with the right trend lines and see things changing, and it all is happening. I think the most important thing for us, or for me personally, would be the left without being seen. And to me, the reason that is such an important measure is because those are patients that were in the waiting room that felt like they needed to come to an emergency department, and for some reason either didn't want to wait and left. And those patients are the ones that make me really worried, because there could have been a really true reason that they needed to seek that treatment. And what is this delay going to do to their health if they leave? So when I first got here, our left without being seen was in the 6 to 8% range. National benchmark is 2%. Once we started to implement the Vocera communication, we started to see that decrease. And I am superbly excited to say that we are at about 1.5% or lower. It has been dramatic. So that is one of the things that I am most excited about from a safety perspective.
Well, your enthusiasm is warranted, and I not only can I hear it in your voice throughout, but how fantastic to get to see this vision come to life, and then have something that reinforces that what the vision is working. So that's a fantastic metric. Anything else? Any other
absolutely. Ones? So just in general, I want to think about it. If I put myself in our patient's shoes, their ability to get back into the department now is dramatically changed. We've taken about 32 minutes off. The fact that once they have come into the door to sign in for treatment till they get back to the room, we have shaved about 32 minutes off of that. So clearly they're able to see a physician much faster now. And again, that is getting them the care they need. The other piece to that, we implemented some really excellent processes with the Vocera team's help on specific, for patients that are coming in with a heart attack or patients that are coming in with a stroke. We implemented specific groups for that we can broadcast out across the whole department. And so with that, if it's a code stroke is what we are saying, if we have someone that comes in that we are suspecting that they might be having a stroke, if we broadcast out code stroke, that will go to all of the designated people that we want to respond. So that would have our respiratory therapist, the physician, the nurse. We have our chaplain come in, whoever needs to be in there. So our stroke numbers have greatly improved as well in regards to getting them back into the CT scan and meeting some of those regulatory benchmarks. We've been able to take about 20 minutes off of when they come into the door and present with that to where we're getting them to the CT scan. So they're able to get the CAT scan sooner, which means we're able to determine if we're going to give life-saving medication for them. Same situation when it comes to our chest pain patients. So it's been really exciting to see how we can take the device, build the workflows around some of those really time-sensitive diagnoses as well, and get the patients what they need. And then on top of that would just definitely be in regards to kind of what I touched on a little bit, but our patient experience scores have absolutely improved. Our overall scores went from, when I got here, it was about the 61st percentile, and we are at the 75th now when you look at the overall. And much of that is correlated to the fact that we are informing patients about delays. That is just a key ticket item for those that are working in the emergency department. And we've made drastic improvements in regards to that. So we've seen our patient experience scores go up. So those are just some of the main ones that are sticking out to me right now. But definitely there are others. Our lab turnaround times have improved because, again, we're all connected. And all of those things feed into and play into the left without being seen go down, our average length of stay showing improvement as well.
Well, these are all fantastic metrics. I can't get over the volume of different things that you're both tracking, but also can demonstrate. How long have you been live on this system?
So this past January was a year and 4 months.
Great. So
yeah.
I was going to ask the question of, so now you're in, we'll call it steady state. Are there, aside from just continuing to both maintain and improve these really key metrics that you talked about, where you're beating benchmark values already, any other things on the horizon, things that you're trying to tackle, maybe even new? I think you said you had code stroke and a cardiac version. Are there other things like that you're rolling out?
Absolutely. We just at the end of March, so it's still new for us, went live with code sepsis. So for our patients that we are concerned that are coming in and they are septic from an infection, that is, the evidence is showing that it is just as time sensitive as stroke and a cardiac arrest, and that it's really about getting antibiotics into a patient in a timely manner. So we have built a workflow around that and made sure that if we broadcast, that we have the designated individuals that goes to as well. So that way we are having, once that's broadcasted, everyone knows to respond specifically to that patient's room, and we're initiating our protocols in a much more rapid fashion than we were before. I don't have any data yet on that one because it's so brand new, but that is something that we are working on. And then something else that we've done is we do not have the luxury of being on an EMR, just one EMR. We have multiple EMRs within the organization, and of course, none of them really want to talk to one another. So Vocera was able to really help with that as well. And so when we have a patient that's holding in the emergency department but has orders to be admitted, which is on a different system, Vocera audibly notifies our nurse if there were any medications ordered, because we want to ensure that that patient, that their care starts immediately. And those types of situations really only happen if the whole hospital's full, we're slim on beds, but yet they're still coming through. So we have that aspect that we're working on, and then really looking at our discharge times now. We've done so much work on the front end to improve our triage process and to decrease the amount of time it takes to get the patient back to a room. And now we're going to work on the discharge piece. That was the other thing that we just recently went live with. And so now Vocera audibly notifies a nurse on their device when their patient is up for discharge. So we hope to see the back end now also improve. So we're able to get patients out back where they need to get going, getting their medications or prescriptions. And then that again opens up another room for a patient that's in the waiting room that really needs to be seen as well. So those are the things that we're most excited about that we've got going. And
You're a busy lady.
Yeah.
Well, thank you so much for sharing all of those new initiatives. I feel like you need to come back in like 6 months and tell me all about how they, kind of transpired. It's like having the first chapter in a book and not knowing what the ending is.
I know. I would love that, because the other thing I'm excited, we just started today our employee engagement survey. And so I am excited to see what kind of an impact this has had on staff satisfaction. So that's the other piece too.
Oh, that's
so
true.
I feel exactly like that. Like I've made it through the first chapter, and like I'm excited to see what's going to be next.
Well, that's fantastic. Well, thank you so much. We are out of time today, but I am so happy that I had an opportunity to talk to you, and I'm sure our listeners are going to have loved hearing all of your stories about your success with this communication device and your enthusiasm for all the changes that you've made. So thanks again, Deanna.
Thank you.
Thank you, Deanna, and thanks to our audience for tuning in. You can learn more about the show on the programs page on healthcarenowradio.com and lend your voice to the conversation on Twitter at #VoicesInVBC, and be sure to follow me on Twitter at Beth Houck. I'm Beth Houck, bringing you the voices in value-based care you should hear. Until next time, have a great week.